Hi, I'm Anita, and this is Care Experts, brought to you by CareCredit. The CareCredit credit card can help you get the look you've always wanted now. CareCredit is accepted at hundreds of thousands of locations nationwide for things like cosmetic surgery, injectables, and other beauty procedures. Today, we're in Los Angeles, California with Dr. Faris Yamin. Dr. Yamin is a licensed plastic surgeon in Beverly Hills. Dr. Yamin specializes in rhinoplasty, facial aesthetics, and body procedures. So, Dr. Yamin, today we're talking about BBL, or the Brazilian butt lift. So can you explain to me exactly what that is?
Good question. So basically, Brazilian butt lift, it was popularized by Brazilian surgeons. That's why the name came from it. But it's really mainly focused about enhancing the volume and shaping the buttocks area.
Okay.
So mainly, it can be done with multiple approaches, but mainly it is fat grafting to the buttocks area, sometimes using implants or injectables in that area.
I'm sure patients are very curious about how long it lasts and is this permanent?
So if we are using fat grafting, meaning your own fat, we're taking it out, purify it, and place it there, that's permanent.
Okay.
You get some swelling from the procedure. You lose a portion of the fat that's not going to survive, but whatever survives stays there. Now, if we are using injectables, meaning fillers, depending on the type of the filler we're using, they are usually not long-lasting. The longest that can stay maybe a couple of years.
Okay. Now, is this a painful procedure, you would say?
If we're doing liposuction combined with fat grafting to the buttocks, there will be some discomfort that will last about 5 to 7 days. Most of my patients, by the second week, they are up and going, and most of their pain is controlled. If we're doing filler injections, meaning an in-office procedure, the discomfort only lasts for 1 or 2 days.
Okay.
If we are using implant placement, there will be a little bit longer period of discomfort.
So talk to me about what the recovery time is like, and I know it might vary based on which procedure you do.
Exactly. So if we are doing liposuction, and if I'm doing a BBL, I usually combine it with high definition liposuction. Might as well get the benefit of the liposuction itself. Then purifying the fat, placing it in the buttocks. That's usually takes a little bit of a recovery there. We have to make sure that the fat that we grafted in the buttocks area will survive. So any pressure or any extreme movement might compromise the survival of the fat.
Now, is BBL dangerous? Is there maybe certain types of people that should avoid it?
If you do it safely and you do it with a board-certified plastic surgeon, member of the society, follows the restrictions and the recommendations, no injection into the muscle or the fascia on top of the muscle. You don't want to go under that fascia anyway, because fat can sneak into these veins. It is a safe procedure, and you can get a great aesthetic outcome from it safely.
And how much would a patient expect to pay for BBL?
So BBL's ranges around between 15 to 20,000. Also, it depends on how much you want to do. Some ladies, they have a good volume and projection. They are looking only to address the hip dips, or we call them the C-point dips on the buttocks. So the fat grafting is not that extensive. Also, how many areas you would like to have with the liposuction.
Thank you, Dr. Yamin. We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on Brazilian butt lifts. So are there other non-surgical options for BBL?
If you are not looking to go into for surgical procedure, or you don't actually have the fat resources to add the augmentation, then you can use fillers. Most of these fillers, they go away within 6 to 8 months, maybe if you're lucky, 10 months. If you're using the Sculptra, which is it's a stimulatory filler, stimulates your body to create its own collagen, so it can last longer. We're looking at 2 to 5 years, but it's definitely not a permanent result.
Would you say injectables are safer than BBL?
I mean, in the hand of a well-trained plastic surgeon, the safety levels.
What would the average cost be for BBL injectment treatments be?
So that also depends on how much you're injecting.
Okay.
So, one syringe of hyaluronic acid filler will cost around maybe $1,000.
Okay.
The Sculptra, depending on how much you're injecting, will cost between $1,500 to $2,000. But there's no way you can get a result with only one injection or one session. So, in the end of the day, if you want a bigger result, you're
Got
gonna
it.
do multiple sessions, multiple injections.
Now, can BBL be done with implants?
Yes, correct. So I do both. If you don't want the fat grafting or you don't have the resources for the fat grafting, you can use implants. They are different from breast implants. However, they are also made of silicone. They are more solid and more cohesive than breast implants. And usually they are placed under the gluteus muscle to give the shape and the projection. However, it's not my preferred approach.
Okay.
I prefer to use your own natural fat. It's better. It can be better sculpted and molded to give better shape, has better projection, and also you get the benefit of the high definition liposuction. But sometimes patients do want buttock implants for that.
And what would the risks be if you are using implants?
There isn't much risks, but the recovery is a little bit longer because you are actually addressing the muscle and
Okay.
you're lifting the muscle, and there will be a foreign body sitting underneath the gluteus muscle, so there will be some pain and movement restriction comes with it. Like any other implant, it's a foreign body. It can have a hematoma or infection that can be associated with it, which is much lower when you're using your natural fat with the fat grafting.
Yeah, makes sense. Well, thank you so much for that information, Dr. Yamin.
Definitely my pleasure.
Thanks for watching. All of our featured care experts accept and recommend the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.